Good afternoon, ladies and gentlemen. Happy New Year also. Since I was last on this blog, we had some holidays in between. We talked briefly about different issues with the kidneys, kidney disease, and what complications it can bring to your health. Today, we will talk about why kidney disease is important, why everyone should need to know if they have a kidney disease or not. We all talk about breast cancer, we all talk about diabetes, we all talk about heart disease. Very few people, like I mentioned in my last blog, will go to the doctor and ask them if I have a kidney disease or not. And believe it or not, 14% of US population, based on the last estimate, have kidney disease of some sort. It doesn't mean that everyone who has a kidney disease have to be on dialysis. I also described many years ago that kidney disease is a silent killer. To your surprise, nobody dies from kidney disease. People die from heart issues and complications of mostly heart and other conditions that have led to the kidney disease, for example, diabetes. In 1999, New England Journal of Medicine, this is a very reputed journal, they had data that if you are a 35-year-old and if you are on dialysis, your heart attack risk is same as somebody who is 85-year-old and not on dialysis. Besides that, in 1999, American Heart Association, in their guideline, they put that if you have a protein in the urine, that means from nephrologist standpoint or any doctor standpoint, your kidneys are abnormal. Protein is not good in urine, protein is good in blood. So in your blood that gets filtered to the kidney, and if your kidney filters are weak and if you start leaking protein in the urine, what American Heart Association at that time figured out that people who had a protein leaking in their urine, the risk of having a heart attack was as good as somebody who had a heart attack before. So coming back to the silent killer part of this kidney disease, 14% of US population will make close to 30 to 40 million population who has different level of kidney disease. Out of that, on dialysis, we have only barely 500,000 people on dialysis. What happens to people in between? They all die. They never make it to the dialysis. They die before that from the heart issues and other complications that I described. Other part about the kidney disease being silent is you never have symptoms. If you have diabetes, you'll be peeing more, you will not feeling well. Kidney disease is so insidious or slow in onset. It progresses so slow in most of the population that they never get to the stage of getting symptoms. So, for example, if you have a magic hand, you can take one of my kidney out. That means I lost 50% of my kidney function. And guess what? You can live for 40 years without even feeling anything about it while you have lost 50% of your kidney function. Now that I'm talking about in a perfect health person who has some reason to have a kidney taken out, they will live normal life. For example, people who donate their kidney, they don't have any complications. However, if you have half of your kidneys lost from diabetes, high blood pressure, or any other complications, poor heart, then you will have all the effect of bad kidney with all the waste product building up in your body, eking away your body inside out. So it's very important to know, if you think of it this way, at 14% rate, 1 in 10% person around you probably have a kidney disease. If you are in Port Charlotte County or Charlotte County, it's even worse because it's more common in people who are elderly. Fastest growing segment of our population with kidney disease is 65 and above. In our county's average age is 65. So in our county it will be even higher. So that's why it's very important to be aware that kidney disease exists. There is something you can do about it. And simple testing can diagnose kidney disease. You can ask your primary care or your family doctor, do I have a kidney disease? Have you checked my kidneys? What is my kidney function level? The simple question, like you always ask, do I have a diabetes? Do I have a high cholesterol? Do I have a heart attack, or do I have any heart issues? We never ask our primary care about, do I have abnormal kidney function? So you can only address the problem if you know there is a problem. If you don't know that problem exists, you'll never work on it. We will talk about other risk factors that leads you to have an increased risk of kidney disease in my next blog.